All right, let's move on to the periodontal ligament fibers. So to recap, there are four tissues that make up the periodontium, or four things that surround the tooth. We looked at the gums, which is the gingiva. We looked at, let's scroll up so you can see what we looked at. So we looked at the gums. Now what we're going to look at is the periodontal ligament fibers, which is the black line that you see surrounding the tooth. We'll also then look at the cementum and then the bone. Those are the four tissues that make up the periodontium. Those are the four things that surround the tooth and the four things that we really need to concentrate on. That's going to make up our whole perio course. So when we're looking at a picture of a tooth, we see that here's the tooth, and we can see these black lines that are over here. The black lines are your periodontal ligament fibers. And for this class, or for this lecture, I just want you to know what it looks like. And so I'm going to zoom in to this area over here. And when you zoom in over here, you'll notice that on one side, the periodontal ligament fiber is attached to the cementum, which is over here. And on the other side, it's attached to the bone, which is over here. So the periodontal ligament fibers are just lines like this kind of connective tissue, lines that attach to the root on one side, or the cementum to be more precise, on one side, and the bone on the other side. Now what I want you guys to know is that the end, so the endings of the periodontal ligament fibers, they have a fancy name, and that fancy name is called Sharpie's fibers. Okay, so that's just the name of the ending of the very end of the periodontal ligament fibers. They're known as Sharpie's fibers. Okay, let's talk about the cementum. So the cementum is, maybe I'll try it over here. So here we have the crown, here we have a root, and the cementum basically covers the entire root. Okay, so the cementum covers the entire root. So if I have to color in the entire root, that brown color that we're looking at is the cementum. It's kind of like a hard layer. It's attached to the dentin, but it's softer than the dentin or enamel. So remember, we have the enamel, and then on the inside of the enamel we have dentin. So it's attached to the dentin. It's sticking to the dentin, but it's very soft. And if you remember, so if we look at the dentin, so we have the enamel, okay, and then we have the root, and then we have a dentin, which is in between. And so what I want you guys to know is that this is the dentin. The dentin has tubules. Okay, so it's got lots of holes. And what the cementum does, let's see if I can draw the cementum here. The cementum kind of covers the entire dentinal tubules, or covers those holes that are in the dentin. And what's really cool about that is that if the holes or if the tubules was not covered by cementum, you would feel a lot of sensitivity. So it's so great to have cementum there, because the cementum covers the tubules so that you don't feel sensitivity. Okay, so cementum is really cool. When we're debriding, we don't want to aggressively take off the cementum, because it can expose these tubules, it can expose these holes in the dentin, and that would make us feel more sensitive. So the cementum seals off or covers the dentinal tubules so we don't feel sensitivity. Another thing about cementum is that it becomes thicker with age. So, if you're grinding and clenching a lot, you'll notice that people have I should change the color here, that people would have a lot of cementum as they grow older. And we'll discuss that more later on, but as they grow older, you're going to notice that people have a lot more cementum at the bottom. So as you get older, with age, the cementum does get thicker. Okay, we're going to talk about the bone now. So the bone is another part that is around the tooth, right? Another tissue that surrounds the tooth. So this is your bone over here that surrounds the tooth. Some words that I want you guys to know is your alveolar bone proper, also known as your cribriform plate. So it's basically, the way to describe it is, if you look at this picture over here, do you see that this area has no tooth? And there is, I want to see if I can color it in. So this shaded area over here that I'm shading in, I don't know if I like that actually. Let's see if I can undo that. Okay, but basically the shaded area that we're looking at over here, this is your alveolar bone proper. It's a layer that's like lining the socket. The socket is the area where the tooth is missing. And so the inside part that we're looking at, so the inside bone that we're looking at inside the socket, that is known as your alveolar bone proper. And I have a different picture later on that I'll show you. But alveolar bone proper is that outline of the socket, the outline of that hole. And the alveolus, so this word over here, is the entire socket. So that hole or the gap or like the air that we're seeing inside this area over here, that is your alveolus. So wherever there's no tooth, what we're looking at is your alveolus, and the bone that is outlining that socket, that bone, that the inner bone, is known as your alveolar bone proper. So alveolar bone proper is the outline of the inside, and the gap that we're looking at is known as your alveolus. And then we have something called cortical bone and cancellous bone. And so cortical bone, also known as compact bone, is the bone that forms the outer wall. So here is your cortical bone. Let's see if I can outline this better. So this over here is the cortical bone. The outline of this is your cortical bone. So it's the outside is your cortical bone. Cortical bone is kind of like your outside. We can see it over here. Cortical bone is on the outside. So this is your, so this picture over here is taken from like this over here. Okay, and I've just kind of reversed it or mirror imaged it and attempted to draw it out. My apologies for the horrible drawing, but that is your cortical bone over here. And we also have an outline over here. That's cortical hard bone. Okay, cortical is like hard. And then cancellous bone is the inside part, and it's the spongy bone. You can see it has holes in it. That's kind of spongy. If we look at the x-ray, this on the inside, so this part over here, you can see it's more softer. That is your spongy cancellous bone. Okay, so cancellous bone is over here. Cortical bone is hard bone. That's on the outside. Cancellous bone is on the inside, usually found in the interproximal area as well. Interproximal means inter means in between. Proximal means kind of like, think of in between teeth. So interproximal area are areas that are in between teeth. Also, what I want you guys to note is that these gaps that we're looking at here, so here we have a tooth missing, here we have another tooth missing. That, if you're looking at the outline, so the black outline that you see over here, that is your alveolar bone proper. So it's the outline. Okay, when we're looking at it from, looking at it directly, the outline that we're looking at, the black outline that we're looking at is your alveolar bone proper. And the space, the hollow space is your alveolus. Okay, so the outline is your alveolar bone proper, but the space is the alveolus. Last thing I want you guys to know is something called the periosteum. So if you're looking at the gum, so let's say I'm looking at this picture over here, the pink thing that we're looking at, the gum that we're looking at, is known as your epithelial tissue. So epithelial tissue is your outside tissue. Okay, so that's what I've kind of drawn over here. So the outside is your epithelial tissue, and then we have layers. So imagine underneath the epithelial tissue, we have another tissue that is your connective tissue. And I think I drew this somewhere above here. So this pink thing is your epithelial tissue. Then we have your connective tissue, okay, which is underneath the epithelial tissue. Underneath the gums is your connective tissue. And then, yes, we do have the bone, but there is one layer that is just above the bone. So let's look at this picture again. We have your epithelial tissue, that's your gums. Underneath that, we have your connective tissue. And connective tissue is where all your blood supply is, and we'll look at that later on. And then we have a thin layer, maybe not thin, but we have a layer that's called periosteum. So remember, the word peri means around, and osteum, I want you to think of bone. So it's a layer that's around the bone, and the periosteum is right here, and then we have the bone underneath. So if you look over here, we have the bone that's over here, and so there's actually a periosteum layer that's right on top of the bone that's covering the bone. So these are the 4 layers we see in the mouth. And I want you guys to know those layers, and we'll talk more about it as we move on. But we have the epithelial tissue, which is your outside layer. Then if you cut through, you would cut through your connective tissue, then you would cut through the periosteum, and then you would see the bone. So there's kind of layers that we're cutting through to access the bone, for example. So these are just different terms that we might see throughout the course, and I thought this is a great introduction to understand the different tissues that make up the periodontium and some words that you will see as we progress through the perio course.